Hey everyone, and welcome to another edition of Ask the Doctor. Ask Dr. Rick. I'm Mike Claiborne as always, and we have a chance to visit with Dr. Rick Lehman. And this evening, we're going to do something a little different as we have a chance to expand what we do here on ClaibsOnline.com and certainly with Dr. Rick. First of all, Rick, it's great to see you again, sir. You have been a busy man.
Yes, sir. We're at the bottom of the Grand Canyon and spent about 4 or 5 days floating the Grand Canyon, and then more excitingly hiked out, which was an endeavor. So glad to be back on land and alive.
I can't wait to hear more about the venture now that are in the Sir Edmund Hillary of a climbing club. That had to be a lot of fun. And we're going to have some fun tonight because we got a lot of things going on. And as we talk about sports medicine, there's so many things about the industry, whether it's comes from procedure to technology. But the one thing we don't talk enough about is rehab. And that's something we're going to get into tonight. And I know for you, over the 35 years you've been in the business, there's a lot of things that take place, but the end result is how well people are able to deal with rehab and how serious they take it. And we're going to talk to some people who are going to make it, I would say, a little easier. But as you know, rehab can be a very big challenge. And we're going to have a chance to talk with our good friends from Ermi, as you see, free to move again and free to live again. And that's important, isn't it? Because when it comes to rehab, the movement and being able to get back to yourself and not make yourself better is something that everybody strives for. And certainly because of what Ermi's been able to do, it certainly made it an easier task.
Well, I think, first of all, for sports medicine doctors like myself, dealing with pro athletes, college athletes, et cetera, rehab is everything. We can do whatever we want to do, but if you can't rehab your ACL or rehab your shoulder, then the surgery really doesn't do any good. So rehab is, as we say in the industry, everything, number one. Number two, anything we can make easier, more effective, and technologically advanced obviously makes the rehab better and shorter. So Ermi's been great because they've been on the forefront of helping sports medicine doctors like myself, orthopedic surgeons like myself. And I think that can only, make us look good, make the patient look good, make the surgery look good.
All right, so why don't we do this? Let's bring into our conversation the CEO for Ermi. He's Dr. Thomas Branch, and it's always great to visit with him. And first of all, Dr. Branch, thank you for joining us. And more importantly, congratulations on making so many people's lives better thanks to you and your outfit and what they can do for people when it comes to rehabilitation.
Well, thanks for having me. I think it's important, as we've all talked about, as a sports medicine. In sports medicine, our job is to return patients to full function and free to move again, free to live again, but just free to enjoy life again. And our task is to help those orthopedic surgeons. I'm an orthopedic surgeon. I'm a sports medicine fellowship trained. I was down at the University of Florida for my fellowship, but I can tell you, managing these people and helping that patient get to the next level after an injury is so difficult. And one of the most difficult things is motion loss. That is the scar tissue forming disaster that results in the inability of the patient to fully recover their motion. And so you can think, what's the number one complication in orthopedics? Well, it's motion loss. Without motion, you don't get function return. And as Dr. Rick said, our job is to get these patients better.
You know, one of the things I wanted to ask you about, and the unfortunate thing about our society, you've had a chance to learn and listen to a lot of veterans who've been in battle, who've had to rehab, and it's unfortunate that they have to go through this. But obviously, it's giving you and your company an opportunity to learn and find out what works and what's more effective compared to other individuals. And certainly you can transfer that into sports medicine, I'm sure. But how important has it been for you and your staff to be able to learn from people who have been in obviously life-threatening situations and are trying to put their lives back together?
I was 4 tours of duty as the chief of orthopedics at the Atlanta VA when I was on staff at Emory University. And it was readily apparent, since there's only a limited number of these VAs scattered around the country, and they're in geographically positioned spots. and they cover huge areas. And oftentimes I would see, as the chief of orthopedics, patients that were stuck with their range of motion. And there was no real local physical therapy or local program that they could go to in order to try to recover that range of motion. So they would stay at the VA for weeks and months on end. And so the idea is how can we bring the same level of pressure, of loading, of stretching of a therapist to the patient's home? And how can we do it in a way where they can apply that pressure daily or 3 or 4 or 5 times a day so they can stretch the tissue as opposed to tearing the tissue? Stretching causes lengthening. Tearing causes more scar formation.
Yeah, I think that's exactly right, Dr. Branch. And I think that's an important distinction, number one. And tell us a little bit about how the technology works. Why is this better to stretch? And I think you're 100% right. If you go to physical therapy, you're there for 30, 40 minutes, maybe you're there for an hour. Or if you've got something at home, you can do it 3, 4 times a day. You may only do it 20, 30 minutes, but obviously the total time is much higher. But explain the technology and explain how that works and differentiate those two, the stretching and the tearing, please.
Okay, sure. Back when I was a young attending at Emory University, I was looking at how scar tissue forms. And one of the things that happens is that when you tear through vascular tissue, and I realize this gets technical, but if you tear through vascular tissue, it produces VEGF. And VEGF is a cytokine growth factor that accelerates scar tissue formation, and it's done in a way to prevent the patient or an animal from bleeding to death. So that formation, it occurs when you tear the vascular tissue, and so it produces that scar tissue. So we know that if we can deform the tissue like silly putty, slowly, silly putty stretches. But if you pull it fast, it's brittle. Scar tissue is viscoelastic, like silly putty, and you have to live within that range where you can stretch it without tearing. Now, how do you know you can stretch it without tearing? Well, the patient feels it. And if you can use a system where the patient has feel at all times, like our system is a hydraulic system that allows the patient with the good extremity to feel the stretch of their injured or scar tissued motion loss joint. And that feel allows the patient to put as much pressure as they can without hurting themselves, without causing that tearing to occur.
As we talk about what you and your company are able to do with regard to devices for rehab, what's been the biggest change you've seen? Because a lot of people, when they have surgery and they have, whether it's an ACL, you name it, they don't take it to the next level in understanding how the rehab process works. And because of what Ermi's able to do, you guys have kind of A, simplified it, and B, being able to show them the results, what they can understand, and as you just mentioned, what they can also feel.
So you're exactly right, but we want to partner. One of the problems is these companies come in and they provide a thing, and that thing is something that they ship to the patient, or they don't get involved. And I know as an orthopedic surgeon, as does Dr. Rick, that you want a partner to help you with this process, and you want to look at that patient and involve the patient in that process to get them better. I mean, 65% of postoperative costs are related to additional surgeries for in that postoperative period. The object is to eliminate that those surgeries, whether it be manipulation under anesthesia, arthroscopy for lysis of adhesions. All those things are immediate surgical things that create more scar tissue.
Well, I think even more important than that, and you kind of hit on something really important. What is the first thing you have to do after you have your surgery? You have to get your range of motion back. You can't start strengthening. You can't talk about sport-specific activities. So you can pick any operation you want, ACL, as Claves talked about, rotator cuff tear, etc. But what's putting the key in ignition? And putting the key in ignition, the first thing you have to do is get your range back. So the quicker you can get your range back and you're 100% right, have a partnership with a therapist and a partnership with a physician so everybody's involved, then you can begin phase 2, which may be strengthening, leading to sport-specific activities. And I think that's where you guys separate yourselves.
One of the things that happens is that people think, gee, all medicine, all this additional medicine is expensive. But when you look at the reduction in surgeries related to managing motion loss without additional surgery, or the complications that occur with the manipulation under anesthesia, like distal femur fractures or additional rotator cuff tears that can occur where additional surgery is required, the cost goes way down. In fact, we have a study that was done by WellPoint. We've saved $4,500 a patient after all of our expenses. And that's just bare minimum. That's not talking about early return to work and the cost reduction related to that. Eliminating the need for disability. All these things are critically important. And we're not interested in treating the 85% of patients that do well after surgery. I mean, they do. 85% of the patients do fine. They do not need us. We only want to treat the patient that needs to be treated, and we do not want to treat the patient that doesn't need to be treated.
You know, it's interesting you bring that up about treating that group of patients that obviously need a little bit more attention, because while we want to say that every surgery is going to work out perfectly, the rehab program is going to be scripted and everything's going to work out, not necessarily the case all the time. So what are some of the common things that you run across when maybe there's a rehab program that maybe isn't working for that particular individual? And how does Ermi able to step in and really make the process maybe a little bit more transparent, where things can be a little bit more effective after there's a little bit more knowledge obtained?
You know, that's exactly, you know, it's important to partner with a physician so that somebody besides the physician is looking out in that postoperative period. The therapist, the Ermi rep is keeping an eye on the patients. We can keep an eye on reps or on patients when we're given an opportunity perhaps to use cold therapy. So now we see the patient from an immediate post-op period. We can put them on a Ermi-based app that asks them how they're doing, and we can follow them along, and they can take pictures using a selfie stick. They take pictures of their knee or shoulder, and it gives us an idea if they might be a candidate. Again, we are not the surgeons, but we are helping that surgeon decide, yeah, maybe that's a good point. Maybe I should use something. Maybe, well, why don't we wait? All of those things are important in the process of identifying the patient who might need us. They might not, but at least we get to get them early. And when we get them early enough, identifying they're not responding, we can have quicker results.
Tell you what, why don't we do this? Because you have a great team that you've been able to put together to really give Ermi the opportunity that it certainly deserves to be involved with other patients and their future. Why don't you introduce your other teammates this evening?
Sure. I have two fabulous individuals. Jonathan Shaw, he's our director of sales, but he's wasn't practicing physical therapist for a very long period of time, and has used Ermi for years. And also John Ranieri, who is head of our business development. He is a vet and understands the complexities of being taken care of in the VA system and how important it is to keep those men and women in our minds.
All right. I don't want to hog this up because I got all these guys who have more smarts than I do, but I got a lot of questions. So I want to start off with John. John, you being a vet, you've been around a lot of people who have had injuries because of battle and things of that nature. What are some of the common things that you were able to be involved in that you felt that the Ermi was a good mix for you and a good match for you, considering your experience, the hands-on experience that you were involved in?
Yeah, thank you. So that is, that's been a huge thing that's really kept this job exciting and rewarding, is being able to work inside the VAs all around the country and with veterans. And it's really just the simple things, So a lot of times, a lot of these war injuries aren't as the catastrophic type that you may think. It's the injured knee that turns into needing a total knee later on in life. It's all the wear and tear on the shoulders that end up having to have surgical, intervention. And then for them to be able to get the range of motion back, get to therapy. Like Dr. Branch said, they're dispersed, so often it's quite a ordeal to get into a VA center in a timely manner from distance or just appointment wise. And I think that's what's made Ermi so exciting, is because we can help bridge the gap between those visits in the comfort of the veteran's own home, utilizing our products that give that smooth, clean feedback. So there's not a lot of muscle guarding or fear. So I think being able to work with veterans who are just frustrated after a surgery and want to get back to the activities of daily living in a very fast manner. Having been able to see Ermi do that time and time again all around the country, it's always the same thing. It's they thank us, they thank our other professionals out in the field with them. You keep in touch with some of them, so it's very, very rewarding.
So John, real quick, I mean, you made a very good point about the VA, but there is crossover in terms of people that maybe can't get to physical therapy as frequently. Maybe they have a lot of patients, NFL guys that live in Montana on a farm, and physical therapy is 200 miles away. Some patients don't have the ability to take off of work. Maybe they work in an office, they can't get to physical therapy. So kind of walk us back just a little bit and tell us how this relates to not only the vet, which is very important because the VA system has its weaknesses, but tell us about the general non-vet or the average person who also has a similar situation, who can't really attend physical therapy as frequently as maybe their orthopedic surgeon would like them to.
Well, yeah, you're exactly right. It doesn't. People are busy. People have a lot of distances, or they have schedule conflicts. So we don't replace therapy. We are just going to be that one portion of it, which is going to be helping to restore range of motion. And I think being able to do that again in home every day. It's about doing it 7 days a week, because I think you talked about it earlier, Dr. Rick. You said that in therapy, and Jonathan can go into this in detail, they only have an hour a lot of times with the patient. And that might be 2 or 3 times a week. So what's happening in that interim, right? Home exercise routines are great. However, you got to do them, right? And I think the one thing about the Ermi product compared to really any other solution I've come across is that the simplicity of the products and the way we set it up in the home and the location, once it's adjusted to the patient, that's it. No one else has to help you put it on or utilize the device. And that ease of use really fosters the compliance, followed up with our team constantly following up with them, and that helps them utilize that and get back. Because I'll tell you, like young athletes, I'm sure you've dealt with many of them. They don't want to miss a season. If they're going to miss one season, they don't want to turn into 2. So we want to be able to get them back, and I think we've proven that time and time again with motivated patients. And actually, to be honest, and even only kind of motivated patients, because it's so simple to use. Getting that range of motion treatment between visits allows that to get out of the way. So then, therapists like Jonathan can do what they have to do to get the rest of that strength, balance, and function back. So any candidate that wants to have an interim between those 2 therapy visits, it's a great solution.
I want to bring in Jonathan Shaw in the conversation, and Jonathan has a PhD in physical therapy. And Jonathan, just to touch on something, because therapy is something that you have to want to do, and you can't do it in just a visit. It's not like when people say, hey, I've got a physical trainer. I just worked out with my trainer. And then the other 6 days of the week, they're sitting on the couch doing nothing. The same thing I would assume applies when it comes to therapy. While as good as Ermi can be in going to see the therapist, Ermi, in my opinion, or from what I've been able to gather, is there to make it more convenient for that person at home, where they don't miss the scheduled therapy session, and they'll be as far along as they need to be, if not farther.
Yeah, I think that's exactly right. Therapy sets people up to have a good result after surgery, right? Surgery gives them a viable joint to work with. Without surgery, we wouldn't have a viable joint to work with. But therapy, we set people up to heal. And some of these patients that we treat over here at Ermi, they have a response to surgery that makes them very stiff. And you guys have talked about it throughout this podcast. You have to stress the tissue enough to cause a difference, but not enough to re-injure it. And, therapists have an hour and we have to work on range of motion. We have to work on strength. We have to work on coordination. And oh, by the way, we have to do all that without irritating the joint so much that it swells up and they backslide. And 2 to 3 times a week is sometimes not enough for those patients that get really stiff. They need frequent stress or stretch to that joint to regain that range of motion, to remove that bottleneck of a restricted joint so they can bend it and straighten it. And we can, as therapists, work on the strength and function that's key when they're in the clinic. Because we only have a certain amount of time, and to address a joint as stiff as the ones that we see at Ermi, that's just not enough time to make a big enough difference to recover fast. And oh, by the way, the slower they recover range of motion, the more their muscle's going to atrophy, and the longer strength and coordination you're going to take to get back after they recover their range of motion.
So Jonathan, real quick, we've talked about the device and we've talked about what happens, but no one's really explained the biomechanics. You're a foot soldier. You've been in the clinic. You use this extensively. How does it work? I mean, what do you do? Explain it to our listeners.
Yeah, absolutely. So we treat a number of joints: knee, ankle, shoulder, elbow, great toe. And what Ermi does, it's a program, and that program involves devices, and our devices are hydraulic and they're patient controlled. And what I mean by that is, it's not a motor in there. It's a lever that the patient can move, and it's a very smooth movement. And every, inch of movement on the lever is a small amount of movement that in the joint. So let's take the knee, for example. The patient sits down, puts their foot in a pedal. There's a handle right next to them. And as they push it, that foot pedal is going to slowly push that knee up. And it's going to be patient controlled. And so what we tell patients is we have them push it to a comfortable stretch, hold it for 10 minutes and release it, and then push it back up for another 10 minutes of a comfortable but firm stretch. And that high intensity load over, 3 20-minute sessions every day gradually causes that scar tissue that Dr. Branch talked about to reform, because it's plastic. It changes under stress. It reforms instead of tears into a nice longer set of tissue in that knee, and you gradually gain that range of motion back slowly, safely. And that's why, we've treated, over 100,000 patients with no adverse events.
So you have surgery, you try to get your range of motion back, you're having some issues, maybe your shoulder's stiff. When is it time to make that change? When is it time to say, what I'm doing isn't working, physical therapy is not getting it, we need to bring in some heavy hitters, maybe we need to call an Ermi rep and have them talk to the patient? Give us a time frame.
That's a great question. Most of the time we look 6 weeks of physical therapy with minimal progress and range of motion is when typically we're looking at deploying the Ermi program. As after 6 weeks, the first 3 days is inflammation, 3 days to 3 weeks is scar tissue proliferation. At 6 weeks, you should be seeing some scar tissue reform and that range of motion returning. If that's not the case, then we like to intervene quite quickly at 6 weeks to get their range of motion going before that 3-month mark, when it gets even more difficult and that range of motion or that scar tissue gets even stiffer and harder and less compliant.
That's excellent. So, and tell us how long you treat them for. Do you treat them for a day? You treat them for 6 weeks? How long generally? I guess every patient's a little bit different, because my experience has been very, very positive with Ermi, in that patients have regained motion very quickly. But give us, again, as a foot soldier, how long can you, the first question is, how long do I have to use this thing for? What do I tell the patient?
Yeah, absolutely. I mean, we operate on 4-week time frames, so 30 days. And so we check in with the patient every 30 days to monitor their progress. So we would deploy it. They would use it for 30 days. And a lot of our patients get better in 30 days. On average, our patients get better in around 58 to 75 days, depending on the patient and the joint. You know, shoulders are a little longer because it's more complex. But anywhere from 1 to 3 months is a pretty safe bet.
Dr. Branch, real quick, give us the most common surgeries you think that your devices have been beneficial for sports guys like myself.
Okay. Any shoulder case where you're doing a rotator cuff, you're repairing that rotator cuff, maybe you're doing a distal clavicle resection at the same time, maybe you're managing the biceps, and every additional surgery you do in that transmission creates more scar tissue. And because the shoulder is got layers in it, it's got the capsular layer, it has the tendon layer, it has the bursal layer, and all those glue together, that it does require a more unique rehabilitation process. It used to be that we just did early motion on those patients. And I'm sure you had a period of time where you were doing early motions, and we saw the Mayo Clinic guys published a paper saying 30% of those patients went on to re-tears. And that got us, in my generation, a little upset. We started thinking about it, and we said, okay, let's hold them a little longer. But if we hold them longer, we have to have a solution to help them regain that motion. We can't leave them out of commission for 3 to 6 months. And so that's where we started saying, okay, in the shoulder patient, particularly the complex shoulder patient, that we need to start a new view of how we're going to manage them. And that's where this came up, Rick. And so that is important. All those fractures, anytime you have a fracture, periarticular fracture of any kind, tibial plateau fracture, distal femur fracture, patella fracture, those guys get so stiff, and you need to move them. And if you don't move them, if you move them early, oh no, something will happen. If you move them late, oh no, it happened. I mean, so you really, if you can figure out, if you can get it healed and then get them in an Ermi program, those periarticular fractures are it really works under those circumstances.
Hey, Dr. Branch.
Go ahead.
I was just going to say, Dr. Branch, you just used the term, it used to be, and we're no spring chickens here in some cases. But the question for you is, since Ermi's emergence, how much time from a rehab standpoint has been cut down because of Ermi and its effectiveness? And also for you, John, as people watch and listen to this podcast, patients always want to be more in the loop. So should patients, when they have a consultation with their surgeon, their orthopedic surgeon, should they be able to inquire and say, tell me about Ermi and what the pros are for it? Because apparently there don't seem to be very many cons. So should patients be more proactive in requesting Ermi as part of the rehab process? So I'll start with you, Dr. Branch.
Okay, so we know, and there's multiple published articles, for instance, for the total knee, that there are 22,000 articles in the literature saying that 95% of total knees are better at 2 years. Wow. When we look at 1 billion lines of claim from the IBM database, 1/3 of those patients are still making claims on their total knee after 2 years. So what's going on? What's happening here? What's happening is that patients are not getting their motion. They're lingering. They get 6 months of physical therapy paid by the insurance company. It may or may not work. If it doesn't work, they're lingering on until they get a surgery. So we know from our use of Ermi and our follow-up of 100,000 knees, for example, and 90% of our patients get to 90 degrees. I don't care if they start under 60 degrees. So the minute you eliminate that, and the average period of time is in the knee is 6 weeks. In the shoulder, as Jonathan pointed out, is usually 2 months. And so that alone accelerates that recovery and then allows that patient to avoid additional surgery.
So explain what 90 degrees is for our listeners. What does that mean?
Okay, good. 90 degrees is where if your knee is perfectly straight, 90 degrees is 90 degrees bent.
So you're sitting in a chair.
Means you can get out of a chair. You can get off the toilet. 90 degrees means you get to 105, you can climb stairs. You can't, to run effectively, you got to get to 120. To do the things that you really want, let's say you wanted to go kayaking or something, you got to get, that knee has got to get to 140, C2 canoeing. I mean, you are a ballet dancer and you can't get your range of motion beyond a certain amount, you may not be picked up. If you're a NFL quarterback and you can't get full external rotation of your arm, you're not going to throw the ball as far. I mean, there's just so many aspects of range of motion that impact biomechanical function. I mean, Rick, don't you think?
Well, first of all, I think you're 100% correct. I think your idea of entering into the equation early, you're talking about totals. And I think sometimes what happens is doctors they hope the range is going to improve. And for me, hope is not a very good treatment plan. So I think for the patient or the people listening, I think it's a reasonable thing to go, just like Claves was saying, and say, hey, is there something I can do independently that will help me get my range of motion back? So if I'm a patient and I'm listening to this podcast and I'm having trouble early on, certainly I can bring that up with my doctor and say, I heard about this device. And of course, a doctor, hopefully, and I would think 99.9% of the cases, has heard of the device. And Mike's 100% correct. I think an independent question and a very informed patient, they get the best results. And I think you're 200% correct on my throwing athlete. So if you can't externally rotate, which is kind of the stick 'em up position, and you can't get your arm rotated backwards, you're not going to throw a baseball or a football or a javelin or swim. So I think that's on the money. And again, I think you need to enter in the equation earlier, as opposed to, as you said, let them linger.
Yeah. Yeah. So, and just to answer that, so as Ermi continues to grow, we're currently in 26 of the 50 states. So we're not across the whole country, but we do spread from coast to coast, just not in every single market yet. And a lot of, we continue to grow and add territories and add sales professionals and patient care technicians into those areas. Because the one thing is, like we alluded to earlier, is that this isn't something we're going to ship to your house, right? This is a product that comes with a professional that's going to help you bridge the gap between the therapist and the surgeon. And we want to make sure when we do it, we do, really quality patient care, quality follow-up, and education on the front end. So that does take time for us to grow. But yeah, absolutely. Hopefully a lot of your viewers will see this. They'll go to our website, realize that, hopefully we have someone in the area that can send an inquiry in. And if we're close, at least, then we can work with them.
Yep.
Jonathan, why don't you comment on it's simple, but they're biomechanically correct. Like, for instance, why don't you tell them about the new ankle device?
Yeah, absolutely. And I do want to comment on one thing, that the data that Dr. Branch mentioned is really important to note, that we have a very high success rate, but a high success rate on those patients that already went through physical therapy and didn't get their range of motion back. So it's not like we're putting this on everybody. And because most people, like we said before, are going to get better, but the ankle is one of the things that we just rolled out this year, and it has been widely accepted and with open arms. And I wish I had it when I was in practice. And so we isolated the ankle in our new device for a bent knee and a straight knee. Now, why is that important? It really depends on the injury. And as Dr. Rick probably can tell you, there's a big difference between stretching dorsiflexion, or the motion of pulling your ankle, your toes towards you, in a straight leg or a bent leg position. And why it matters is because one of the major muscle groups crosses the knee. So if you bend the knee, it actually slackens that muscle group and puts less tension on it. And you can isolate the ankle joint and the soleus muscle, or if the physician needs, such as like an Achilles tendon rupture where the gastroc is particularly stiff, that gastroc, that muscle that crosses the knee, you can stretch it into a straight knee and get dorsiflexion, whatever the patient needs. And so Dr. Branch and his R&D team are constantly working on improving our devices and making them even more effective moving forward. That's one of the best things about coming over here in the past 2 years is I used Ermi my entire career, from start to finish. I mean, it was in the clinic when I got there and it was in the clinic when I left, and I used it throughout my entire tenure. And some of these devices that have come out in the last 2 years with Dr. Branch coming on as CEO are just absolutely amazing. With the app, we have a new elbow, right? We never had a good elbow solution in the clinic and all elbows kind of get stiff. So there's a lot going on. And like John said, we're expanding the market. So we should be bringing this to more people every day.
Continuing research.
It sounds to me that the next step is bringing back a bunch of the old broken down war horses who've lost motion, range of motion. It sounds like you're going to create some comebacks for some people in those pickup leagues and everywhere else around the world when it comes to sports and the need of an orthopedic surgeon along the way.
I'll tell you, some of the patients I saw in the clinic who had been stiff. I mean, they had been on. I was their third therapist, and we put them on an Ermi, and they got their range of motion back after even a year or two. So yeah, that's if you got a range of motion loss problem, I would definitely be asking about us.
Well, that you bring up athletes. I mean, there's so many athletes all you guys know, that have used the device to recover as quickly as they can. We can't mention all of them. I mean, we've got HIPAA that tells us we're not supposed to tell things. I mean, I can tell you one person who's agreed to allow us to share it, and that person was Adrian Peterson. Adrian Peterson won Comeback Athlete of the Year, and when he stood up at the microphone, he thanked Ermi. I was a little worried, but I appreciate, because I think you need to thank everybody, the surgeons and everybody, but because we're just one part of the process. But certainly he was very appreciative of having our system and program available to him.
Well, gentlemen, as we wind things down, this has been quite informative. It's great to hear that there's a company like Ermi that's out there that can help so many people along the way. And as we talked about, recognizing the injury, performing surgery to correct the injury, but the thing we don't talk enough about and obviously don't learn enough about until tonight is the opportunity to understand what rehab is about and what Ermi can do to get people back to a normal way of life. And for what you guys have been able to do and what you continue to do for people down the road is something that we're going to get more into over the course of time and let people know that they'll be better prepared when they visit their orthopedic surgeon. B, they'll have a better understanding of how rehab truly works. And C, they'll have a happier life. I'm certain of that. And as you mentioned, Dr. Branch, Adrian Peterson is obviously one of thousands who've been exposed to Ermi that can get back to the way things used to be, if not be better.
It's all about the patient. All about the patient who needs us.
Well, Dr. Rick, I'm going to let you wrap things up.
Well, listen, you guys, first of all, I think it's very informative. Just before we end, John, tell us how the patient can get some information, and how do they get connected to their rep? Give us a little information to pass on, so when that patient says, I think this might be something I'm interested in, I want to take the next step. What is the next step?
So yeah, they can start really just like going to the website. That's probably going to be the best way. We're also on all the social media sites as well if they look for us. But down there at the bottom, you can see, you just go to ermi-motion.com and they can go in there. They can look at all our different products and solutions. And there's also a link in there they can request more information. And if they're in a geographical area that we have representation, we'll connect them right with that local professional that can help, educate their physician if for some reason they hadn't heard of us, or let them know, if they're a good candidate or not, and they can really help with them there. So that's probably the easiest way. Otherwise, they can talk to their therapist or doctor about it. Just if they've heard of it, which most of them have. We do a lot of stuff with residents and the upcoming and a lot of students, so they get exposed to it. So every year, it's more and more of those that are going out around the country having been exposed to the Ermi solution. So it's a pretty unique name, and it's a very specific, unique device. And the beauties and the simplicity. So yeah, definitely ask your healthcare professional about it, and we can try to link up with them.
I think that's great. And I think if there is an interest and they want to talk to someone who's used the device, they can always call our office at the U.S. Center for Sports Medicine, and we can hook them up with a patient who's had a similar problem, who's used the device, and kind of walk them through it. But again, I think it's important, if you're listening to the podcast and you're having some stiffness, you're having trouble getting your range of motion back, you need to take your own rehab in your own hands, and you need to talk to your orthopedist, just like Mike said and Dr. Branch said. So be aggressive.
All right, gentlemen. Hey, this has been a blast. I'm looking forward to us getting more into what Ermi's all about, and rehab, certainly, for sure, and certainly with Dr. Rick and all the people that he knows and we're going to be talking to down the road. This has been a lot of fun. We certainly thank you all for spending your time with us. And I know I'm a lot smarter about Ermi, that's for sure. I would almost say I can't wait to go out and have a rehab, but I'm going to hold off on that. I'm going to hold off on that. But I know that there are people that on a constant basis have to deal with these sort of challenges. And now that they'll have somewhere to turn to get more information and get on the road to recovery a lot quicker, thanks to Ermi and all the people that are involved. Gentlemen, thank you so much for your time. We'll look forward to doing this in the very near future. For Dr. Rick Lehman, I'm Mike Claiborne. We thank you for watching Ask Dr. Rick on ClaibsOnline.com.